You've probably seen the word monkeypox popping up everywhere, right? We're going to break down exactly what this virus is, how you can stay safe, and what you really, truly need to know, all based on expert medical advice.
So, why all the buzz all of a sudden? Well, it's because the World Health Organization has officially declared monkeypox a global health emergency. Now, that's a pretty big deal. It's basically their highest level of alert, and it's a signal to countries all over the world that they need to take this seriously. This is why it's all over the news, and it's why getting our facts straight is more important than ever.
All right, let's dive right in. Here's our game plan. First, we'll unpack what this global emergency actually means. Then we'll get into what monkeypox is. After that, we'll cover the symptoms you need to look out for, talk about the risks and treatments, and then we'll wrap up with the most important part, a simple playbook on how to protect yourself.
To really get why this is a big deal now, we need a little bit of context. You see, for decades, monkeypox was mostly found in parts of Central and West Africa. The reason it's a global emergency today is that it has spread way beyond those areas. We're seeing cases pop up all over the world, including right here in India. That international spread is the new critical piece of the puzzle.
So what is this virus anyway? Where did it even come from? Let's take a closer look at its backstory, because honestly, its history is key to understanding what's going on today.
Okay, so at its core, monkeypox is a virus that originally jumped from animals to humans. Now, though, it's figured out how to spread between people. But the most crucial thing to get right off the bat is this. This is not a brand new disease that just appeared out of thin air. It's actually been around for a long, long time.
And this timeline really tells the story. I mean, look at this. Scientists first spotted it way back in 1958 in monkeys used for research. That's actually where it gets its name. But the first time it was seen in a person wasn't until 1970. For decades after that, it stayed pretty contained. The big dramatic change is what's happening right now, this rapid global spread.
So, how does it get around? Well, the original pathway was from animals to us. This usually happened through direct contact, like a bite or a scratch from an infected animal. And as you can see, we're not just talking about monkeys. Rodents like squirrels and rats can carry it too. But what's really relevant to the situation today is how it's spreading from person to person. And there are a few different ways this can happen. It can be through respiratory droplets, from a cough or a sneeze, through contact with body fluids, through very close physical contact, and even by touching things that an infected person has used, like their bedding or towels.
Now, this right here is a really critical point of difference, and honestly, it's pretty reassuring. We all know how easily COVID-19 can spread through the air. Well, monkeypox is different. For it to spread through droplets, it requires much closer, more prolonged contact. This is a huge reason why it's not as contagious in just casual, everyday situations.
Okay, next up, let's talk about recognizing the symptoms. Honestly, knowing what to look for is one of our best tools for keeping this thing contained. In the very beginning, this thing is a little sneaky. For the first few days, the symptoms look a lot like many other illnesses we've all had. A fever, headache, sore throat, chills. One sign that's a little more unique is swollen lymph nodes, maybe in your neck or armpits. But even so, it's really tough to tell it apart from a regular bug at this early stage.
But, and this is a big but, here's the number one sign, the thing that truly sets monkeypox apart. After that initial fever, a very specific rash shows up. So if you see a rash developing, especially if it's on the palms of your hands and the soles of your feet, that is the big red flag. That's your signal to be alert and get medical advice right away.
And this rash isn't just a one-and-done kind of thing. It actually evolves through several very distinct stages. As you can see, it usually starts as simple spots, maybe inside the mouth, on the face, palms, or soles. Then those spots fill up with fluid, which eventually turns to pus. After that, they can break open and form sores before finally scabbing over and healing. This whole process can take a few weeks.
Okay, so let's shift gears and talk about risk and treatment. Understanding who is most vulnerable and how doctors actually approach this illness helps put everything into the right perspective.
Looking at the data, the mortality rate is estimated to be somewhere between 3 and 6%. Now, of course, any fatality is serious, but it's also really important to flip that statistic around and look at the other side. The vast majority of people, over 94%, survive. For most people, it's a mild illness, and they recover fully in about 2 to 4 weeks.
However, that risk isn't the same for everyone. There are certain groups who are more vulnerable and can get a much more severe form of the disease. This includes children, the elderly, people who are malnourished, and really anyone with a weakened immune system, like someone going through cancer treatment.
Now, when it comes to treatment, this is key. There isn't a specific approved medicine that just cures monkeypox. Instead, what doctors provide is called supportive care. That means they focus on managing the symptoms, like bringing down a fever, and really critically, preventing those skin sores from getting a secondary bacterial infection, which can be a serious problem.
And now for the most empowering part of this whole conversation, the clear, simple things you can actually do to stay safe. Because knowledge is great, but action is what keeps us protected.
The good news is, our best defense is built on simple habits that should feel very, very familiar at this point. This prevention playbook shows it all. Washing your hands often, wearing a mask if you're in a crowded space, not sharing personal items like towels or utensils, and just being mindful of close physical contact. These are all super effective strategies.
And if you find yourself caring for someone with monkeypox at home, following these steps is absolutely vital. First, isolate them in their own room and make sure it has good airflow. If you're the caregiver, you have to wear gloves and be super strict about washing your hands. Use separate dishes, separate bedding, separate bathrooms. Wash their laundry separately in hot water. And finally, just focus on good nutrition and keeping them hydrated to help their body fight off the virus.
And that really brings us to the most important takeaway of all. In a world with constant health alerts, it is completely natural to feel a little anxious. But as we've just seen, having clear factual knowledge lets us replace that fear with caution and effective action. This understanding isn't just powerful for you, it's powerful for our whole community. So please share this information, because the more people who get the real facts, the safer we all are.